Welcome back to Beyond the Scalpel. I am one of your hosts, Dr. Elie Levine.
And I'm your other host, Dr. Jody Levine. You can learn more about us at plasticsandderm.com.
Our featured guest for today is Lisa Moskovitz.
Yes, she is a registered dietitian and nutritionist.
An author.
And I'm very much looking forward to speaking with her.
But first, we're going to talk about what we do before the big day.
Wedding season is here. We are officially in the month of May. And May through August are the top 4 wedding months. What do you think's number 1?
June?
Very good. June is number 1. 10.8% of weddings happen in the month of June. We got married in number 2, August.
I remember that.
So let's talk about weddings. I think we should speak about what people can do before their wedding, working backwards from the big day.
I agree. So we'll do that. I mean, the truth matters, and we'll go through it. In the ideal world, you come in a year before your wedding or something like that, or a significant time period before and say, these are my concerns. What's the best time to address it? But it doesn't always happen that way.
No, and something that happens more frequently than I wish is someone comes in last minute and says, I am getting married in a month, or my daughter is getting married in a month. What can I do? But let's talk about the brides themselves, because the numbers of people coming in for cosmetic work, number of people under 30 the numbers have increased dramatically, right?
Have crazy numbers.
So we are going to talk about mostly people getting married. Okay, so with it, someone comes in, my wedding's in a month, what can I do? I guess I'll go first
because this is in many ways more relevant.
Right. We're going to try to avoid major surgery a month before your wedding.
Not advised.
However, and
that's my professional opinion.
But even non-invasive work, I do not like to touch somebody with anything new within a month of their big day. If someone has had Botox in the past and now it's a month before their wedding, certainly we're going to do Botox, and it takes Botox a good 2 weeks to set in. So for sure we want to have, I would say, minimum 3 weeks before the wedding, because every now and then there could be an occasional bruise. So you certainly wouldn't want that for your wedding.
What do you do if they get a bruise?
Well, I laser. If we offer laser complimentary after all injectables, and lasers dramatically increase the healing of a bruise. So
here it is. I'm walking in for the big day. It could be the bride, but it could be the groom.
That's true. That is true.
And
so one thing that is an easy fix and really very rewarding is laser photo rejuvenation. Brightening up your skin tone, getting rid of all that sun damage and the dullness that you have from years of sun exposure, and that's sun exposure from your childhood years. So a laser like the BBL or IPL, that does take 1 week to heal. So theoretically, if you came a week and a half before your wedding, we could do it. I don't recommend that, because sometimes people can get pimples after laser. It's not frequent, but there are some people who break out after laser. So that is not something we want to play with. Although I do have a trick for that. I do give people some steroids a few days before and after their wedding in an emergency. But okay, so something like that. Technically, we could do it within a week and a half, but a month would be better. The Pico Shore laser, which is another really favorite of mine to make your skin bright. You see those results maximally at 2 weeks. So, and again, I wouldn't want it to be exactly 2 weeks in case
it doesn't go away effects 4 weeks.
Oh,
right?
No, they're gonna look gorgeous, definitely. But I would want to stick to that 1 month mark.
Okay, so it's Botox and lasers, not crazy aggressive lasers, but lasers that have predictable healing time.
Exactly, and also a light chemical peel I would do for sure. I mean, we do peels that don't even make you actually peel, just brighten up your skin tone the very next day. So that is another good one. Okay, something I can think of that I do, but you do as well, is the liquid rhinoplasty.
Yes.
Talk to us about that.
So I've been doing that for many years, and you definitely want to go to someone who has a lot of experience with this, because there's a lot of complicated anatomy. and safety issues, you really want to go to a practitioner who knows exactly what they're doing, and they do this a lot. It is unbelievably dramatic and natural and spectacular and addresses so many things. So what can be done? If someone has a bump that they don't like and they want to camouflage that, if someone wants a little bit more definition to their tip, if someone wants to lift their tip, if someone's had a rhinoplasty, don't really necessarily love it. It's a little bit imperfect, but not enough that they actually want to address it. And obviously they're not going to fix it surgically right before a wedding. Doing things like that are all spectacular. It is unusual for people to bruise unless they're on like blood thinning medication, in which case you probably wouldn't want to do that anyways right before the wedding.
Right.
It's unusual to have any real downside to it. Mild swelling for a day or two, and you see it right away. You see it. You give them a mirror, and they're like, "Oh my goodness, I'm like a new person." They're like ready to start snapping photos right there.
And I actually realized we didn't define liquid rhinoplasty, which is adding a little bit of filler to the nose in a very specific place in order to really reshape the nose dramatically. All right, so I think that completes our liquid rhinoplasty. Then let's talk about 2 months before the big day. Does that make sense to
Totally.
work?
Yeah, totally.
Okay, what can you do then?
So, I mean, I would think that just continuing the whole filler discussion, there are a whole lot more options because, one of the things that we kind of didn't really broach on it, but is relevant is like you could theoretically bruise from anything, but the likelihood of bruising from a liquid rhinoplasty is really quite remote. And there's certain places on the face where fillers similarly can have very limited amount of bruising, but you can get bruising, especially kind of the lower third of the face and areas like that. So I imagine with 2 months, you would say that there's a whole lot more leeway with that.
Definitely. I would totally feel comfortable doing filler 2 months before. Okay, so let's talk about 2 months before the wedding.
Yeah.
What are you willing to do then?
So I imagine, let's kind of continue this discussion. We were speaking about fillers of liquid rhinoplasty. The likelihood of bruising from that, while never zero, is quite remote. Right. Fillers, you can do a lot of fillers without a lot of bruising or downtime, but lower third of the face, certain areas definitely bruise. But I imagine with 2 months, you feel pretty comfortable with.
I do. 2 months away, we can do fillers for sure. I would say 3 weeks after filler is your safe zone, but 2 months before would be great.
Okay, so if you did it 2 months before and you decide you want to kind of touch it up, like 5 weeks before or something like that, then you're
perfect.
Golden. Okay.
Yes.
And what are the options? I mean, obviously,
Oh, you could fill anything. What do people usually ask for? I would say, and assuming you're getting married before, in your 20s or 30s, lips is a very common one people want. What do you think?
Lips, yes, you're spot on with that. I think lower eyes is a big one.
Yes, just filling in that indentation. Yeah. People with deep set eyes.
I feel like chins are a big one.
People don't think of chins. We think of chins.
Interesting.
Yeah, I mean, and that's my experience. Is that your experience?
I don't know. I mean, sometimes they come in asking for it, but I hear your point.
My patients normally will say, "What do you recommend?" And of course, I always ask what bothers them. But when I bring up the chin, that's something they don't realize. And then when we fix it, it's very exciting.
Okay. Any kind of lasers that are different than the ones we spoke about?
If you're working 2 months before the wedding, you can do an ablative laser to get rid of scars.
Yeah.
Let's say someone has a lot of acne scars. We can do a real ablative laser that takes some healing time. It takes 5 days to heal, but then you can still have some residual redness for a few weeks. So that we can do 2 weeks before.
Yeah.
2 months before. I'm so sorry. But I have a question. What about liposuction? Because that's another common one that brides want, and sometimes grooms.
So with 2 months, it's tight. Now, when we get to 3 months, there's definitely stuff we can start to talk about.
Okay, tell us why. What is the recovery? Why are you saying that?
So, there are certain areas, whenever I'm doing liposuction, I'm generally using a radio frequency based device to tighten skin down as well, because it's not just about volume, it's about skin laxity. And if you address one without the other, you're under treating, or sometimes even just changing what the problem is, and as opposed to eliminating a problem. The problem is that certain areas you see a lot of those results early on, and certain ones take a lot more time to get there. So here's an issue. If someone has a pretty flat belly, not a lot of loose skin, just a little bit of fat, and it's 3 months before the wedding, and they make one little tiny incision really low down at the bikini line, and we do liposuction even under local, and we do some skin tightening, by 3 months, they're already going to look better. Now, will they look even better 9 months after that as the skin continues to tighten down? Yes, but by 3 months, it'll already pay dividends.
Right. If they want to look amazing in that bikini on the honeymoon, you're
And
okay
even
with
if
3 months before?
Yes.
Okay.
Now, if someone has an element of skin laxity there, skin laxity could come from having a pregnancy in the past, from weight changes, weight fluctuations. There, the skin is going to be a little thinner and a little more loose. And because of that, it's going to swell more. And I probably wouldn't recommend doing it at 3 months. It may be more like 4 or 5 or even 6 months to really its full effects. Now,
I have a question.
Yes.
What about the little bra fat?
So that,
or not, the under.
yeah, right. So it's like right where that, right outside the bra. So if you're wearing kind of a gown where you're seeing that, or a bathing suit and things like that.
There's a lot of people.
A lot of people.
Yeah.
So it depends why you have that. If it's volume related, fat related, and a little bit of skin laxity related, then yes, they'll respond pretty quickly. And even by 3 months before, they'll see some improvement.
Okay.
Again, not the full effects, because that skin tightening really doesn't even begin to start to kick into gear until about 6 weeks before.
But they'll
6
look
weeks
better.
after the treatment, they'll look better. If it's all skin related, it's going to really be quite modest, the amount of improvement they have. There are certain areas that really do respond beautifully early on. So if you have excess, not just skin, but more like a little bit of fat, treating that 3 months before is a doable thing. Your waistline will not be as good as it's going to be at 6 to 9 months afterwards, but 3 months afterwards, you'll already see improvement there.
Okay, so 3 months before a wedding, you could do lipo, it sounds like.
Yes, certain areas.
Right.
And in certain areas, and you're not doing like full body. So if someone comes in 6 months before their wedding, and we'll jump back to earlier, but 6 months before the wedding, and they want to do kind of full body contouring, they want to shape their belly and their waistline and their thighs and all those kind of things. Yeah, they will. It's a safe and predictable procedure where they'll look great.
Right.
But at 3 months, we're kind of picking and choosing which areas.
Okay, makes sense.
Kind of not for every person.
Okay. And let's say that bride doesn't want to put any stuffing in her gown or pads and wants an augmentation before the wedding. How close to the wedding would you do it?
So probably 3 months is doable, although not ideal. You're probably looking closer to 4 months.
4 months, just for swelling.
It's just swelling. It's comfort. It's accounting for anything and everything, and just being not even the least bit worried. The patient side of things, being the least bit anxious that is this cutting it close.
Right. Okay. That makes sense.
Yeah.
All right. What other procedures would you do on a bride or groom?
So now we're we could jump. Yeah, go ahead.
Hair transplant.
Hair transplant. So
how long before the wedding?
So hair transplant, we'll talk about that when we get closer to a year, because that's the issue with hair transplant is that you're 2 weeks after a procedure, for the most part, you're pretty much recovered and could be back to normal. And if you have really particular ways you like to groom your hair, meaning you want longer hair and shorter hair and certain things like that, a month before, you're totally fine. The issue is more that when you transfer hairs, they go into a dormant phase, and they don't really start functioning early on, and they could take anywhere from 6 months to a year to really start producing significant results.
So
while it's very predictable, you're not going to see the results.
Yeah.
And so that's where, if you do it right before the wedding, you're going to have great hair by your first anniversary.
Right.
But it's not really going to help you for the big day. My question is, there definitely some more things to talk about. Is there something that's different in month 4 and 5, or can we jump to 6? Because I kind of feel like that in between doesn't really do much. Because I would go to 6 months, because at that point you start talking about kind of other things. So puffy lower eyes. Puffy lower eyes are very genetic. And yes, everyone's lower eyes look better at 23 than they do at 37 than they do at 63. Right. But the truth of the matter is, there are many, young men and women who are in their mid 30s where they have really puffy lower eyes. The problem with puffy eyes is they don't age you; they make you look tired. Yeah. And so, if you look tired, not a great look. And yes, you can put makeup on, but it only helps so much. Right. And you can Photoshop photos, but you're not going to Photoshop every wedding photo. So you'll Photoshop photos as still photos. Yeah. You're not Photoshopping dancing photos and animated things. So videos for sure. 6
months before, you're good.
You're good. And so that's very, very good with that, and that works beautifully with it.
Okay. And if someone came to you 4 months before the wedding, would you treat their lower eyes?
If they were someone who describes that they don't necessarily swell that much by nature, just naturally. So like, if I bump my leg, I don't swell that much. If you bump your leg, you swell. You're someone who swells with,
Right.
I'd say you're a moderate
Sweller.
Sweller.
Okay.
If that's a word. Uh, for you, it might be kind of borderline. Not that you're low rise and anything; they're perfect. But for me, it would be fine. And for some people, I'd say no, it's definitely not a go.
Got it. So it's about swelling.
Yeah, it's about swelling.
Okay. What about an actual rhinoplasty? We talked about a liquid rhinoplasty, but an actual surgical nose job.
I think that would work at 6 months.
6 months.
So, depending on the approach that you use, some people by 6 months, a significant amount of that swelling is gone. Some people takes closer to a year, but either way, you look considerably better 6 months after a rhinoplasty. And again, it won't be as good as you're going to look maybe 6 months after that.
Right.
But if your nose really bothers you, if you have a significant bump, if it hangs down a lot, if there's a significant amount of asymmetry, 6 months will work for it.
I agree with that. Although I do find people look their best a year after.
Yes. I mean, there are kind of two aspects. There's what can you do?
Right.
And ideally, what should you do?
Optimal timing.
And I'm most happy for the bride or groom when they come in a year before. I mean, beyond that, even better, because it's really, that's when you can really offer them anything that bothers them. And really, sometimes even certain things can't even be combined, whether it's for safety reasons or for swelling reasons. And it's one of the things where it's like, well, you have to choose A or B at 6 months. You can't kind of do both.
Right.
So if someone came in and said, I want to do my nose and I want to do my lower eyes at 6 months, it's not that you can't, but you're treating the same area, and it definitely increases swelling in those areas. And so it really is, there I'd probably jump closer to 9 months because I don't want to have to take any chances with them. If they're coming in a year, they're so much better off.
So surgically, a year would be ideal. I think for things like filler, Botox, lasers, I would be happy with 6 months. I'll tell you why, because Botox lasts about 3 months. So I would never want to do Botox on someone, or I use Botox as the general term for all the neuromodulators, but I would never want to do it on someone, we just said, for the first time right before the wedding. So you want to have done at least 2 treatments. So the first treatment 6 months before, it lasts 3 months. Then you do it again the second time. Maybe you wait a month, do it again, so that it's perfect for the wedding.
Now, let's add in one more thing. Well, the key really is the bride and groom.
Yes. The flower girl. No, I'm joking. I know it's not
the mother or father of the bride.
Yes.
Generally, or groom. They generally, more often than not, will need more work than the bride or groom.
Right.
And I feel like they're, yes, a year works, but I almost feel like beyond that, a year and a half is ideal.
Well, yes, if you're talking surgical, for sure.
But it's not just a surgical. To me, it's kind of what we do here is a kind of the combination of things. So it's not unusual for someone to undergo a brow lift and a facelift and blepharoplasty and maybe even facial fat transfer and all those things, and they look great. But as good as that looks, addressing whether it's hair pigment or resurfacing or even subtle things like a little bit of filler here or there or a modulator, and timing those things so that you have all the time in the world and you're not trying to rush things and kind of overlap things is really ideal.
And then if we're talking about body contouring, you want to have your body shape before you buy your gown.
Yes.
Right? And sometimes we got to shop for our gown in advance. So
that's such a great point.
Yeah, we need to start that work when our kids start dating, bottom line.
Yes. So should we start that with our 9-year-old?
Oh, no, but maybe for our 26-year-old.
And now we'd like to welcome our guest to the show, Lisa Moskovitz.
Yes, Lisa Moskovitz, RD, CDN, is the CEO of the New York Nutrition Group, founded in 2013, and she is the author of the Core 3 Healthy Eating Plan, a simple and scientific solution to finding your healthiest, happiest body. Hi, Lisa.
Hi, thank you so much for having me. Excited to be here.
Thank you, Brett, for joining us. Nutrition is such an important part of looking good, feeling good. I mean, it really goes so well with what our goal is. And I have so many questions for you, but before I get to that, can you tell us a little bit about the Core 3 Healthy Eating Plan? I know a little bit about it. It's not about dropping foods, it's about choosing the right ones, right?
Yeah. Exactly. There you go. You pretty much summarize it right there. But no, really, the reason behind the Core 3 and the reason why I thought it was such an important book to write is because so many people are sort of in this place, and the industry as a whole has become so polarized where people are either doing extreme diets, or on the other hand, this intuitive eating concept, which has a lot of valuable recommendations and different ways and perspectives looking at food. But at the same time, it could almost be another set of rules. And a lot of people were feeling more confused, like, but wait, I want to lose weight and I want to feel the best I can feel from the inside out, but I don't know what the best option is. Should I be on a diet? Should I abandon all concept of losing weight and just like eat what my body tells me to eat? And I believe there's a happy medium. I think that you can achieve something in the middle where you can improve your relationship with food and find your healthiest weight at the same time. And you don't have to pick a side necessarily. So that was the real, driving force behind the idea of the core three. And then it comes with a more personalized approach. So it's not a one size fits all. It's, which we know it just doesn't work. We know that we have to respect that bio individuality and that everyone is so different in so many ways. So that's kind of it. And then it breaks it down into 3 parts. So you work on your relationship with food and your relationship with your body. And then you go into the science behind healthy eating and even healthy eating for weight loss. It gives you a plan. And then the last part is behavioral change. And how do I get my healthy eating habits off the ground, but also sustain them? And that's the big piece, is the sustainability of it, so that you're not just fluctuating and yo-yo dieting, which we know is not good for anything, especially your skin.
Right. Okay. So let's say my patients want to know what foods they should be adding to their diet to help their skin. And I know that's a very, very, wide question here, because they could help your skin from in so many directions. But, let's just say I wanted to give someone one extra thing, add this to your diet,
And I love that you said add in, because I think we all know at this point, we can look at foods in front of us and we can, on some level understand this is a little bit more nutritious than that. And we know eating excessive amounts of added sugar and ultra processed foods and, high sodium refined carbs in our diet and saturated fat probably isn't going to help our health, but it's not bad when it's done in moderation and under certain circumstances. So anyway, adding foods in is the name of the game, and that little tiny switch can really help improve your relationship with food and your outlook on just healthy eating in general. I would say the biggest things, number one is hydration, and I'm going to go talk about a few different things, but number one is hydration. It's so important not just to drink enough water, but think about how you could get water in your food too. And we know that fresh fruits and vegetables, right, supply so much of that, along with, and they come in a package of other really valuable nutrients like fiber, antioxidants that fight oxidative stress and inflammation, which can accelerate the aging process. So you're getting so much bang for your buck when you're eating more fruits and vegetables, just in general. The other thing that most people don't get enough of is omega-3 fatty acids. We know how important those anti-inflammatory fats are for, again, so many things, from our brain to our gut to our heart, but also our skin. It really can improve our skin appearance and the tone and the texture. So people are so, I don't want to say afraid of fats because that's a little dramatic, but people do shy away from eating too much fat in their diet because they think it's higher calories and I want to lose weight. But you have to think, what are you getting in those calories? You're getting so much value, so much return, on your investment of eating those calories, and it's great for your skin and anti-aging as well.
Okay, so things with omega-3 fatty acids, I know fish, right? Certain fish, salmon.
Correct. Yes, stash, salmon. I have a little acronym. So salmon, tuna, anchovies, sardines, and herring are some of the best of that omega-3 fatty acid. Yep.
Hey, Elie likes some of those things.
Some of them.
Yeah.
Not everybody loves like a jar of herring, but you never know. Right.
Okay, so that's stash. Are there any others we should know about?
The best sources of omega-3 are going to be in fish, but we can also get omega-3 through plant-based sources. Our body has to convert it from ALA to EPA DHA. So that process can sort of break down some of that good omega-3 that we're going to absorb, but that's okay. You know, it's still valuable. So flaxseed and walnut and just a variety of nuts and seeds in general. You can also get a good amount of omega-3 that way. A lot of people are really into nut milks. They fortify the nut milks a lot of times with omega-3, so they can
Does
be
almond
added to
milk
food
have
during.
omega-3? Sorry to cut you off, but that's exciting.
Yeah, not naturally. I mean, it's not going to be a lot, but sometimes you do see it fortified, but flax milk is going to be more of a source of omega-3.
Flax milk.
Yeah.
I've never had that.
But
Oh,
if
they
you
take
have your
everything and
almond
make it
milk,
into milk.
but if you
Go
have your almond milk with your sardines, then you'll be great.
ahead.
Um,
That sounds
so,
delicious.
Excuse me 1 second.
So I have, as Jody steps off set for a second, I have a separate question. So she has skin related questions. My question is that, like, I have so many times where I see patients in consultation for more often that will this relates to body contouring, and you know they won't be the ideal weight at this point for surgery, and I'll say, like, it's not optimal. It's, you know, maybe we can do it, but it's not the optimal time. Let's find the optimal time, and it's oftentimes weight related. And the question they pose to me is, how do I lose weight? And, you know, you go online, you can find a million diets. And back when everyone walked into bookstores, there were a million sections filled up with books. And the one thing that I always say to them is, like, I'm no diet expert, but what I can say is that you'd want to stay away from things that are fads, certain things that are severely restricting or just limit you to one type of food group, because you're not going to be able to maintain it. Because my goal is not to get them to a weight to just do surgery. My goal is to get them to a weight they can do surgery and then maintain it. And so
Yeah.
it's all about maintaining. So what are your key advice tips to kind of key components to try to get into that and
Sure.
stay in there?
For sure. And that is, I'm so happy you brought that up, because you're right. I mean, to go through all of that, lose the weight, get the surgery, and then to gain it back, it's so, you know, disheartening for a lot of people and discouraging. So no matter what, at the end of the day, in order to lose weight, especially body fat, we need a calorie deficit. You need a calorie deficit. You need to be eating less than you're burning. Is it that simple for everybody? No, but that's really the core fundamental science of weight loss. So there's many ways that you can get from point A to point B. There, you can do intermittent fasting, you can do keto, you can do Whole30, you can do you know, basically just, I'm going to eat gluten-free, even people can lose weight with. At the end of the day, it's all helping you eat less. So you're going to create that calorie deficit. But the real question is, what is healthiest for me, and what can I sustain in my life, and what is, you know, something that I want to do and that I have the resources to do. So there is no perfect diet. There is no one size fits all. If you want to do it a healthy way, I always recommend that you don't do anything extreme. Slow weight loss is always more sustainable weight loss, or at least for most people it is. And you want to be cautious of anything that is too extreme, cutting out major food groups, has you losing weight too rapidly. That should raise some flags, because it's usually not as healthy. And then what can happen too is our body can go through something called adaptive thermogenesis, where your metabolism can slow down a little bit. It depends on the person how much that really impacts them. And then it's even harder to sustain the weight and also to lose more weight. So you hit that plateau, and then you go out, you go on vacation for a week, and you gain all the weight back. And it's very, very discouraging for a lot of people. So I would say, no matter what, figuring out what has worked for me in the past, what hasn't. Sometimes you have to know what's not going to work before you know what will. Making sure that you are still working on your relationship with food, that you're paying attention to mindless eating, stress eating. I mean, even the most perfectly crafted diet plan isn't going to stop you when you're in front of the refrigerator at 10 p.m. at night and you're hungry. It's not like, oh, I'm not going to eat something. My diet plan says I can't. That's going to be a whole other part of this, which is just that behavioral change, understanding your relationship with food, getting to the bottom of why you're doing certain things, how you're using food. Is it true hunger, or is something else going on? And I always tell people, look first at the extras. Okay, don't nitpick about the salad dressing and the milk in your coffee. What are you eating in between that you're not even realizing you're eating? What are you eating at night right before bed? That's also going to be the most problematic. And also, are you always finishing everything on your plate? If you're always eating until there's nothing left to eat on your plate, that could be a sign that you're not eating until you're satisfied. You're just taking external cues, and that's telling you how much to eat or not eat.
That
And that was a
reminds me.
long-winded answer, but yeah.
Yeah, no, it's great.
I always finish what's on my plate.
Yes.
Yep.
Yeah, I still remember growing up in Charles. My mom was always talking diets, talking with anyone and
Yeah.
everyone about diet stuff. And we had
Still
this,
does.
still does. And we had we were meeting with some guy, and he was like in his mid-90s, and he was in great shape. I mean, not just the fact that he was alive in his mid-90s, but he was actually in great shape. My mom said, what is the key to it? And he said he never walked away from the table full. He said, I didn't walk away hungry,
Yeah.
but I never
Yep.
walked away full.
Yep.
And it's a good point in terms of like
Yeah.
not finishing your plate
Yeah.
and not necessarily eating late at night. Because I could always eat something late at night, but I don't necessarily need it late at night.
I'm always
Exactly.
full. I always walk away full. My father
So there
taught
you
me
go.
to not leave anything over. There are
Yeah,
people
well, that's it.
who don't
Most
have
people-
enough food. We need to finish
Yeah.
our food.
Most people were raised in the clean plate club era, and it's hard for them to be able to leave food over on their plate, and they feel that guilt, or they were always raised, to not waste food. But at the end of the day, is it still the better option to just eat everything in front of you? So
Okay, so I have another question. Let's say someone is trying to tone or even build muscle. Are there certain foods that help promote that?
for sure. Number one is we always have to understand and respect that body types and skin and all of that, there's a lot of genetic, components to that. And we can't, just because Jennifer Aniston eats this way and exercises this way, if we do the same thing, we're not going to look just like Jennifer Aniston or any celebrity that you might, sort of admire. But there are certainly things you can do that can help the cause, that can get you closer to you feeling your best. Protein being number one. From my experience, people overeat protein or they undereat protein. And there's very few people that get right in that sweet spot. And I won't bore you with too many, equations and things like that. But generally, it ends up being 1.2, maybe 1.5 grams of protein per kilogram of body weight, along with regular strength training, because that's what's really going to help muscle grow or prevent muscle loss, which happens inevitably as we get older. So that's really important, along with a balanced diet that has adequate levels of hydration, that hydrates you, antioxidants that fight inflammation, that really helps with skin appearance. And then we also now know, which is becoming more popular and evident, is collagen supplements. I wouldn't say, again, it's not going to be the same as getting plastic surgery, but it's something you can easily do at home. It has multiple benefits, not just on the outside, but the inside, your joint health. And the natural sources of that are going to be fish and animal foods, along with even avocado is a good source of collagen. Avocado is another really good source of those monounsaturated fatty acids, which are really, really good for your skin. So I would say all of that together is your best chance at keeping and preserving the skin texture and tone that we all desire.
Okay, great. And on the subject of collagen, I never know how to evaluate whether a collagen powder is a good one, or, how do you tell the difference?
So the reality is that majority of supplements are not regulated by the FDA, and there's certainly, if they are, it's not until after they hit the marketplace. So we don't always know what we're getting, and there's rumors about collagen supplements and what's in them, and they kind of like put a mishmash of all these things that, do we really want to be putting that in our body? But at the end of the day, the collagen peptides are going to be the best. They're going to be the best absorbed. I would still look at the quality of the supplement. I'm not going to name drop here, but there's certain brands that are just generally more credible and reputable. I know, and I will, because I know people like brand names, but Vitals is the big collagen supplier that everybody uses, and it's fine. I don't think you need to be super picky with this particular thing. If we were correcting a deficiency, if we were treating something that required like a good quality probiotic, I might get more particular about my brands of supplements because you often get what you pay for
Right.
with supplements specifically. But with something like this, I think it's okay to just shop the aisles, see what's available and affordable for you. And even a little bit every day can help.
Okay, that sounds great.
Wonderful.
All right. Well,
Okay.
thank you so much. You were
Yeah.
so helpful. We really appreciate you coming, and I think we all learned something here.
Yeah,
Good.
thank you guys so much. Glad to hear it.
So Lisa was great.
Yes, she was wonderful.
So this concludes another episode of Beyond the Scalpel.
Thanks, and we'll see you here next time.